welcome to your regular program, Mother Care, and of course a segment on Doctor on Demand. My name is Dr. Martina Agbere. It's nice keeping a date with you again today. Well, we'll just go straight to our question. The first one says, Doctor, please, can someone that has an infection be pregnant? Can someone who has an infection be pregnant? It actually depends on the kind of infection and the place that is affected. For instance, is it a urinary tract infection? Is it a pelvic inflammatory disease? Is it the site of the infection also? The truth is, for somebody to become pregnant, for you to become pregnant, a lot of things come into action, into play. For somebody who has a pelvic inflammatory disease, who probably has the tubes already blocked, the person can be pregnant if the fallopian tubes are affected. So it depends on the site of the infection. But if it's just a sexually transmitted infection that is not affecting the areas of conception, of course you can be pregnant. But for males, it is not only for females that actually will have an infection that will stop pregnancy. For males, it can also affect the semen. So the seminal fluid analysis is also very important for such people. So it depends on the kind of infection we're talking about and the site. If it's just a malaria that you have, if it's just an upper respiratory tract infection that you have, a cough, it won't affect our pregnancy. But if it affects the organs, the areas where conception actually takes place, then it can actually affect conception. Then the second question is, what are the causes of cancer? What are the causes of cancer? Now, the truth is, cancers are as a result of abnormal growth of cells. Like I talked about sometime in the program, it's an abnormal growth of cells, something that is going out of the normal process. There are a whole lot of causes of cancer, but the truth is, lifestyle is very, very, very important. We have a lot of predisposing factors, that is the risk factors. What are the things that can lead to somebody having a cancer? For instance, when you have a sexual life that is not properly controlled, okay, and you expose yourself to somebody who already has a human papillomavirus, you can have that human papillomavirus, which can also cause the cervical cancer. So lifestyle is also very important. How about those that take tobacco? Smoking, cancer of the lungs. So tobacco is a predisposing factor to having cancer of the lungs. Okay, so you have predisposing factors to having cancer. How about the skin? Some people use bleaching cream, toning cream, and of course they're exposed to the sun. The normal thing that protects you, the melanin that protects your skin, is no more there because of what is the ingredient, what is in the cream that you have used. So you are exposing yourself to the rays of the sun directly, and that now gives you what we call the skin cancer. So we have a risk factor, we have the predisposing factors that can cause the normal cells growing out of the abnormal cells growing out of proportion. Then the other question is, good day, doctor. Please, does the human papillomavirus have a cure for those with the virus already? For those with the virus already, does it have a cure? The human papillomavirus doesn't have a cure. If you already have it, you already have it. But it can be controlled so that it doesn't progress. So for somebody who has a human papillomavirus, like I talked about some time ago in the program, which can actually lead to cervical cancer. And remember, it is not all the human papillomavirus that can lead to cancer. There are the strains that can actually just cause the genital what? Then there are the ones that can actually cause the cervical cancer. So when you have the human papillomavirus, it's been detected that you have the human papillomavirus, what can be done, not cure, but it can be managed palliatively. So what is done, you ensure that you go for the screening when due, so that they can discover whenever you have cervical changes. When you have when there are cervical changes, it can be nipped in the bud so it doesn't progress into becoming the cervical cancer. So that is just how you can actually manage it. Then finally, we talked about what are the signs of cervical cancer. What are the signs of cervical cancer? I already talked about cervical cancer. The cervix is actually the lower part of the uterus in the female that opens into the vagina. The cause of cervical cancer oftentimes is as a result of the human papillomavirus. The person exposed herself or came in contact with somebody who has a virus. And that cervical cancer, the signs usually, you have bleeding in between your periods, You also have the abnormal bleeding, abnormal discharge, the waist pain, backache, and of course, pain during intercourse, and even after menopause, you just have abnormal bleeding. Then, of course, vaginal discharge with tinge of blood in it. So these are some of the signs of cervical cancer. But these ones are not always there unless it's almost getting towards the tail end. So it is always advisable to try as much as possible to go for the screening. So thank you so much for keeping a date with us. Same time next week. We hope to be back again on your program, or your segment, Doctor on Demand. Of course, in your program, Mother Care. Thank you so much for staying with us.